First and foremost, thank you for your patience. Excuse me, unfortunately, I am still under the weather. And, however, I did want to make sure you're not just, standing around in the wind. It was my hope to make it today, but that wasn't the case. But anyway, we're going to move on. Excuse me. The majority of this presentation, I am using AI as far as for my voice because, as you can hear, I'm kind of struggling. But I did want to just make mention that this is pretty much just talking about ethical issues in terms of boundaries and competency. And what I want you to pay attention to is I'm inserting a couple of videos that provide some examples, and then from there I'll talk about it a little bit, as well as kind of give you a heads up on the work I would want you to do for your assignment this week. So with that being said, I will make sure the assignments are readily available to you. I will also make sure that you'll be able to submit it in Canvas so you don't have to email it to me. This way I can give you an appropriate grade and it shows the documentation of you completing the work. But on that note, I'm going to stop speaking here. And again, the rest of it is my lovely voice, but with the help of AI. With that note, um, thank you so much for your patience. I hope to see y'all again soon.
Hey, Sonia. Glad we could meet, if not in person, I guess online, huh? So I wasn't sure why you switched over, but I'm glad we get a chance to have our visit.
Yeah, I think.
I don't know how you feel, but I mean, in-person therapy I think is a lot better. Just you know, less bells and whistles going off, and it's just it gives us a chance to be in the same space, the same room. So I don't know, this is a little bit more distant, but you know, um, let's try and make it work, I guess.
Yeah, I just think I'll be more comfortable in this setting.
Yeah, you mean in your home rather than doing therapy in an office, or
just doing therapy with you in the office.
Yeah. So, well, was there something that was making you uncomfortable about it there, or I mean, something you weren't okay with, or I know there's some noise from the neighbors, the businesses around me, and it's a little bit irritating. But
it wasn't the noise.
So, what was it, if you don't mind me asking?
You hugged me last time, and I felt really uncomfortable.
Oh, really? I mean, I didn't mean it that way. I'm sorry it felt uncomfortable to you. I just, I wanted to, end on a positive note, I guess, and let you know I'm really there for you. And, I'm sorry I didn't mean to, make you feel awkward or anything.
Yeah, I just don't want this to be a situation where, like, I don't know, like you fall in love with me or something, or I don't know. It just seemed weird, and I've seen a lot of movies, and it just I just don't want it to. I feel like this is better.
Oh, okay. Well, just to let you know, I mean, I respect your boundaries, and I know you respect mine, and I would never, I'd never intrude that way, or I know this is a professional relationship, and so I want to reassure you of that. I'm sorry if just that hug made you feel otherwise. I certainly didn't mean that in that way. It was just I was trying to show
all your patients or just your female ones, or like I don't know. It just was it just me? Like I
No. I mean, pretty much. It was just the time I was trained in. There was, people hugged after having a difficult session, and and no, it's not. Doesn't have anything to do with being female or anything like that. It's it's just an offer of support and warmth.
Got it.
Yeah. Kind of like I mean, you should get a hug every day, from somebody if you can. So that it makes your day just a little bit brighter.
Mm-hmm.
That kind of like that.
Right.
Yeah. I'm sorry if it felt weird to you.
Yeah, maybe just don't do that again.
Well, no, of course. I mean, of course. Like I said, if you feel uncomfortable, I wouldn't have done it in the first place if you had said something, if you had said you were uncomfortable with it or whatever, of course. But I don't know. I don't know until it comes up, and and in therapy we can talk about such things. So I'm glad you shared that with me. I think that's really good for you to share your discomfort, and I honor that, and want you to know that I hear that. I hear you.
Thanks.
Yeah. So maybe we can try it again, face to face next time. Yeah.
Yeah. Maybe.
Okay. Yeah. Well, what do you want to talk about next? What else is going on?
Just
why hugging a client without permission can be unethical. In therapy, boundaries are not just polite, they are essential. Hugging a client without asking for permission crosses both professional and ethical boundaries. Even if the therapist's intentions are warm or supportive, touch can be misinterpreted, feel invasive, or trigger past trauma for the client. For some clients, unexpected physical contact could create discomfort, confusion about the therapeutic relationship, or even a rupture in trust. The American Psychological Association's APA Ethics Code recommends General Principle A, beneficence and non-maleficence. As I mentioned earlier, these principles are designed to help us improve professionally by inspiring us to be the best we can be. With General Principle A, beneficence and non-maleficence, psychologists strive to help others and avoid harm. So a hug without consent, like in Sonia's case, risks harming her and the therapeutic relationship. The harm is either emotional or psychological, even if unintentional. General Principle E, respect for people's rights and dignity. Clients have the right to autonomy and self-determination, which includes the right to control who touches them and when. Is it wrong to touch your client? Not necessarily. However, demonstrating respect and one's dignity includes not making assumptions about whether your client needs a hug. Now, in addition to the principles, the ethical standards directly caution against boundary issues. Standard 3.05, multiple relationships. A therapist must avoid relationships that could impair objectivity, competence, or effectiveness. Physical touch, like hugging, can blur the line between professional and personal roles. Standard 3.04, avoiding harm. Psychologists take reasonable steps to prevent their actions from harming clients. Since touch can carry unintended consequences, uninvited hugs can violate this standard. Standard 3.02, sexual harassment and misconduct. While a hug itself is not inherently sexual, unwanted or ambiguous physical contact can be experienced as harassment or exploitation by the client, and therapists must be cautious not to risk this. In therapy, a hug is never just a hug. Without explicit permission, it risks undermining the therapeutic alliance and violating APA ethical standards. Instead, a therapist can ask, "Would you like a hug, or would you prefer I just sit with you in support?" By seeking consent, the therapist respects the client's autonomy, maintains professional boundaries, and upholds the ethical principles of beneficence and respect for autonomy. Here's part 1 of your assignment for this week. You will write a reflection paper on the following vignette. Please include how you may have handled the session. Are there any other principles or standards you may include in assessing the ethical considerations? Remember to please use APA formatting. Maria, a 24-year-old graduate student, has been seeing Dr. Lewis, a licensed psychologist, for 3 months to address anxiety related to her academic workload and family pressures. In one session, Maria becomes tearful while describing the stress of disappointing her parents. Wanting to comfort her, Dr. Lewis leans forward and gives her hand a gentle squeeze without asking permission. Client's reaction. Maria stiffens during the exchange. Although she doesn't say anything in the moment, she later tells a friend that she felt invaded and unsure if Dr. Lewis sees me as a client or a friend. At the next session, Maria arrives guarded and less willing to share openly. Points to consider in your reflection. Dr. Lewis intended to be compassionate, but by not asking for Maria's consent, he blurred professional boundaries and unintentionally harmed the therapeutic alliance. Can a therapeutic alliance be repaired? How can this be salvaged?
So Henry, how's things going with your relationship with Maya?
They're complicated.
Sorry to hear that.
Yeah, me too. She's just been real private lately.
Like private, like how?
I know there are things that are bothering her, and I want to talk to her. I want to help her out. She has some really bad history with her ex-boyfriend. And I'm afraid maybe she has that fear in our relationship. So whenever I try to talk to her, she won't budge. She won't let me help at all. And that's really, to me, is hard, because I've been with her for like 2 years now. I mean, she loves me, right? Why wouldn't she talk to me about these things? Why won't she let me in to help her?
Yeah. Well, you have been at it for quite some time, and I know you're devoted to her. You've really put your heart into it.
Yeah.
But it's hard to watch you struggle like this. Hard to watch you suffer.
It sucks. I want to just be a good boyfriend. I just want to be there for her.
But in some ways, Henry, she's not letting you.
No, she's not at all.
And I don't know. I mean, maybe it's time to maybe it's time to rethink things with her.
I'm sorry.
Well, I just see you, going on and you want so much for things to work out. And I want that for you. I can see how much you feel like that would make your life complete, like you've said, and make you feel happy, but it's not coming together. I don't know. Maybe you should just try and talk to her straightforwardly about the situation and about how you really feel about it, and lay it on the line,
Do you think that'll help?
Well, yeah, I think it, at least you know where you stand, and yeah, I think it'd help. Yeah, I think you should try it.
I just want her to know that I'm there for her, no matter what. I don't her past, her history, whatever. It doesn't matter. I am there.
Well, you've told her that already, but I think you need to ask her if she can be there for you.
And you truly think that this will help us be closer, or more of a bond, and be more open?
Well, when you two do get together, you do want her to know how to give to you also, not just you giving to her. So I think this sets the right stage for it. Yep.
Okay, I'll do it.
Yeah.
Another area I wanted to go over is how we meet the ethical requirements regarding competency. Why it's unethical not to know how to handle a client's issue. In therapy, clients place deep trust in their clinician's professional knowledge and judgment. Suppose a therapist does not know how to handle a client's issue and pretends to wing it. That can be ethically problematic. Not knowing is not the issue. Failing to seek supervision, consultation, or referral is. The American Psychological Association, APA, Ethics Code emphasizes this under General Principle A, beneficence and non-maleficence. Psychologists must strive to help and avoid harm. Guessing or providing ungrounded advice could cause harm. General Principle C, integrity. Therapists are expected to be honest and accurate about their knowledge and abilities. Misrepresenting competence violates integrity. Standard 2.01, boundaries of competence. Psychologists must only provide services within the boundaries of their education, training, and supervised experience. Standard 2.03, maintaining competence. Psychologists are expected to keep up with scientific and professional knowledge. If a client brings in an issue outside the therapist's expertise, for example, a complex eating disorder or a cultural experience the therapist has never worked with, it is ethically responsible to say, "This is an important issue and I want to make sure you get the best possible care. I want to consult with a colleague or consider a referral so we can address this together." This shows professionalism, humility, and care. Is it okay to tell a client what to do? Therapists must be cautious here. Therapy is about empowerment and collaboration, not control. Telling a client exactly what to do, "You should break up with him," or "You must quit your job tomorrow," can undermine the client's autonomy. Instead, ethical practice involves helping the client explore options and consequences, supporting them in making their own decisions, respecting Principle E, respect for people's rights and dignity, which includes honoring their self-determination. Direct advice given may seem helpful in the moment, but it risks creating dependency, damaging trust, or placing the therapist in an inappropriate position of authority. Impact on the therapeutic relationship. Trust. Clients may lose confidence if they sense their therapist is out of depth but not transparent. Alliance. Overstepping by giving direct orders can damage the collaborative spirit of therapy. Empowerment. Therapy should foster growth. Telling clients what to do may disempower them and prevent. So, for part 2 of your reflection assignment, please use the following areas as a guide. The questions will be listed in the assignment on Canvas, but these are the areas for consideration. 1. Understanding competency. 2. Boundaries of competence. 3. Therapeutic relationship. 4. At my use versus empowerment. And then your personal reflection. Reflect on an area of counseling where you feel confident in your competency and one area where you recognize you need further training. How might you ethically navigate those differences as a future practitioner? What strategies will you use throughout your career to maintain and expand your competence? E.g., continuing education, supervision, cultural humility.
For the next several slides, I suggest you pause if you need to read the questions. However, like I mentioned before, I will have these questions on Canvas so that you can have it within the assignment itself. But I just wanted to list it up here so you get an idea while you're watching the lecture, so you can start formulating and conceptualizing in your minds now.
Okay, so I will stop here for now. Again, my apologies for the absence. Please do keep up with the readings and assignments. Regarding the examination, after reviewing the syllabus, I see that it should be scheduled for the 9th, so it will go on as planned. I will let you know what type of exam it will be no later than Friday. Now, with that said, there are 2 options I want to present to you regarding next week. The first option is to keep that day as asynchronous and allow the exam to be due that day. Or, since we have not seen each other in 2 weeks, have a face-to-face meeting that day and allow the exam's due date to be that Friday instead of Tuesday. Please send a message with your choice and I will send you the results. That's it for now. Talk with you soon.